My name is Bobbie Richardson. I live at 7309 NC Highway 561 in the great town of Wood, North Carolina. Hope you all know where that is. This afternoon, to our chairman and members of the Franklin County Commissioners, I come before you to urge you to pass a resolution and send it to our elected officials in Raleigh, Representative Lisa Barnes and Senator Alexander, encouraging them that when they go back into session in April, to please support the expansion of Medicaid for North Carolina citizens. I was a member of the North Carolina General Assembly when the expansion of Medicaid was debated on the floor, and it was not passed. And since 2013, North Carolina has not still passed the expansion for Medicaid for the citizens of North Carolina. It is dire that we pass this law so that the citizens of North Carolina and the citizens of Franklin County can take advantage of having health insurance for those who are uninsured or for those who are less insured. If we were to pass, or the General Assembly, I'm sorry, I'm not there anymore. If the General Assembly would pass the expansion of Medicaid, it would have a great impact on North Carolina, and the impact on Franklin County would be as great. For example, there would be 248 jobs created. It would provide coverage for 4,383 more people, and an economic impact of $30.4 million in the county economic growth, and $868,000 more in our county tax. And you can get those figures from the Kaiser Foundation. It was lifted from there. There are some real stories about people who do not have insurance. If a person was to be diagnosed as having cancer or any of our catastrophic illnesses, without insurance, they would have limited ability for the services they need. And even if they have insurance, it is a very costly illness, and it could put people into bankruptcy. We also have a crisis in this state, the opioid crisis. And some of the people who are unfortunately enough to be in that illness have wanted to go to treatment, but many of them do not have health insurance. So just think how beneficial it would be that if my child or if I were an addict and I could go to a treatment and get health care. It would cut down on our police protection. They could have time to focus on other jobs that they have to do. It would be less costly to those of us who are carrying insurance, because those of us who are insured help bear the burden for those that are insufficiently insured or uninsured. I urge you this afternoon to consider that resolution, and we certainly hope that our elected officials will listen to our plea and represent Franklin County in the way that we have entrusted them to do so by voting them in to represent us in Franklin County. Thank you.
Can I ask a question?
Yes.
I was just wondering why, over the years, I've always heard that was an issue at the state level about the Medicare expansion.
Mm-hmm.
Why have they not done that? For what reasons they have?
I wish I could really answer that, Commissioner Ford. On the debate floor, they gave examples of, it was a bait and switch type of program. They didn't trust the federal government to hold up to their end of the bargain. It proposed to cost more money than it would provide benefits. So I don't know. I really wish I did know, because we debated it ferociously and very strongly, and the majority party was in favor of it. Excuse me, the majority party was not in favor of it, and the minority party voted. And now our governor is pushing, and as you know, we do not have a state budget, because that is one of the issues that's been debated as to whether or not that will be passed.
All right, thank you.
Thank you.
Yes, ma'am.
Thank you.
Thank you.